All right. Welcome, everyone. Just to let you know, this webinar is being recorded. Firstly, thanks for joining us for a fantastic webinar today called Preventing and Treating Skin Tears. My name is Tom Vreens and I'm the General Manager at Team Medical. Firstly, in the spirit of reconciliation, we acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. At Team Medical, we're dedicated to supporting you with quality education, and none of that's possible without our great partner, Smith & Nephew, who has brought this webinar to life today for us. From Smith & Nephew, we have Angus on the call. Before we jump into it, just a few housekeeping items. Firstly, just make sure your cameras are off and your mics are also off. We encourage participation throughout the chat. So before we get into it, I'd encourage everyone to open up the chat, put a post in there to say hi and where you're from, if that's a particular medical centre, suburb or state, whatever that may be, please get into the chat and say hi. The webinar is recorded and a link to this webinar will be shared tomorrow. It will also be available on our Team Medical events page, which we'll share the address to later. Please know that after this presentation, we will have Q&A. So please submit any questions you have throughout this webinar into the chat. If the team are able to answer them on the go, fantastic. If not, we'll come back to them at the end of the webinar. Also, after the webinar, there is a short survey that we would ask you to please fill out just to pass on any feedback so we can continue to improve on these types of events. Anyway, let's move beyond myself and onto the reason we're here. I'm pleased to introduce our speaker, Hayley Ryan from Wound Rescue. With over 20 years of nursing experience and a passion for wound care, Hayley is a leader in this field and also the former chair of Wounds Australia. After her presentation, we'll briefly explore Smith & Nephew's wound care products before diving into the Q&A. Over to you, Hayley.
Thank you so much for a lovely introduction, and it's so great to see a number of you from all parts of Australia. The only one I haven't seen yet is Canberra, so if you're from Canberra, drop something in the chat, and then I think we've covered every state and territory, which is fantastic. Look, thank you for joining me today, and a big thanks to Team Medical and Smith & Nephew for the invitation to present to you. And I've termed the topic today the delicate balance, prevention and treatment of skin tears, because it often can be that real balancing, that real fine line between how do I stop it from happening in the first place, but when I get a skin tear, how do I actually manage it? Just a very quick disclaimer, all of the slides that you'll see with patients today, I do have permission to share their photos and their stories. I don't have permission for you to take photos of the screen of those patients, so I respectfully ask you not to do that. Also, I've seen a couple of AI note takers coming into the chat. If you could please remove them, that would be really appreciated because, again, this is the intellectual property of Wound Rescue. But look, I hope that we can have an interactive session today, and please ask questions along the way. Drop them in the chat, but there'll be some time at the end as well. So let's kick it off. What do I want to cover off in this very short time that we have together? Before I even get into skin tears, it's really important that we focus on the skin, that we consider the risk factors and how you can actually get a skin tear. And most of you probably are already aware of that because you're working in that clinical field. How you manage and assess a skin tear, what's the best possible ways to dress that wound, and of course prevention is always best medicine. So I want to kick it off with what actually is a definition of a skin tear. Have you ever thought about it? Here's what we know in practice is that a number of people with a skin tear who get them regularly, it's considered part of aging. But in actual fact, there is no research to support that it is a part of aging. So we shouldn't accept getting a skin tear as a norm. But if we have a look at the best practice guidelines from 2018, their definition of a skin tear is a traumatic wound caused by mechanical forces, including removal of adhesives. Severity may vary by depth, but not extending through to the subcutaneous layer. So it's quite interesting. If you haven't seen that document, get your hands on it. You can simply Google it and it's available free online. So like I said, I'd like to kick this off with a bit of a focus on the skin. And here's what we know, that the normal pH sits between 4 and 6.5. Of course, it varies with age, but in other words, it sits slightly acidic, with the optimal pH being here, this 5.5. Why is that important to know? Because if we have optimal pH of the skin, it protects the acid mantle. And the acid mantle on the skin is what actually protects you from getting infections, protects the skin from breaking down. So it works as a reinforcement to protect you from adverse events such as wounds. The question is, how do we do that? Well, it's simple. We need to really focus on soap-free alternatives. So think about your patients right now. What are they washing themselves in at home? What are they putting on after they get out of the shower? Think about yourself as well. Are you using the appropriate cleansing agents and washing agents, or are you still using soaps that can actually strip the biofilm off your skin and cause it to dry? They're questions we need to be asking our patients. But you also need to consider the person's skin type, because we know that age really does matter when it comes to changes in the skin. For example, for an infant, they have a skin thickness of around 40 to 60% of adult skin. They've got that surface attachment, which is quite limited, and it attaches to an immature dermis. So it can break quite easy, although it's a lot more flexible. Within the first few weeks, the pH actually falls to 5.5. Isn't that interesting? I just spoke about the optimal pH being 5.5 because it protects the acid mantle. In a young child or a newborn, in the first 5 weeks, they purposely have their skin go down to 5.5 to protect it from infections. As we mature and we get into adult life, we see hair follicles changing, sebaceous glands. We get an increase in lipid content, which enhances heat, insulation, and temperature regulation. Unfortunately, we get higher fat content, which means less being susceptible to drying out. And on the other side, as we age, as we get over the age of 65 in particular, we get a 50% decrease in the turnover of the epidermal layer. pH actually becomes more neutral, so it sits less acidic, which makes them more susceptible to bacterial growth and infections. There's a 1% decrease per year of collagen, hence why we see more wrinkling coming out of the skin. The elastin fibers decrease in size and number, decreasing elasticity and causing dry skin. So at this age, they've already got a problem because of the skin biometrics. That means they will become a lot drier. And of course, there's less sensation and pain. So the effects of aging are profound, which is why often when we talk about skin tears, the first thing you think of is, well, it must be an older person who has it. And for all of those reasons I've just explained, but also because they have a decrease in vitamin D, they simply do not get outside as much as we'd like to. They get skin starting to thin quite dramatically, which is why they break, and they have that reduced immune response, which I've already noted. But skin tears are a problem. And what are the actual risk factors? Well, the World Health Organization themselves, as of last week, recognizes that skin tears are poorly reported and possibly due to being perceived as an insignificant injury. So what I want to get to today is that we all start seeing this type of wound as not a part of norm, but start treating it as a potential problem for all people, including immature skin, young neonates, the elderly, absolutely, but also the critically ill. If they have other comorbidities, for example, their skin can break down and cause skin tears. So risk factors include age, we've said that already, a history of skin tears, dry, fragile skin, certain medications, in particular steroids, which is why when we say you're assessing a wound, please always check what medications they're on. Impaired mobility and vision, particularly around cognitive impairment and things like anything that will cause a patient to fall more regularly. Poor nutrition and hydration, comorbidities, dependence on others for showering, dressing, and transferring. And when I looked up the research, the biggest factor of what actually can cause a skin tear on a patient is actually manual handling from the clinician, whether it's staff wearing jewelry, hopefully we're not wearing long nails anymore, but things like that that can cause a patient an injury. So where do they mainly occur? When we think about the elderly, it is often to their lower and upper extremities, so their arms and legs, and the dorsal aspect of the hand. In terms of neonates and immature skin, often the head, the face, and lower extremities. And these are because they're often related to adhesives, taking them off, particularly in the hospital environment. However, skin tears can occur on any anatomical location. In fact, I was with a patient only a few weeks ago who had a 14-centimetre long skin tear on his back, because what had actually happened was his sheet had moved. He was laying on the plastic of his mattress. He's rolled over himself after being there for a long period, and he's taken the skin off, making it a category 3 skin tear. So we know that the causes of skin tears can be trauma, as I've just explained. Falls is a high reason for a skin tear. Manual handling, jewelry and long nails, and of course a knock or a bump. You think about patients living at home, for example, often they will walk into surroundings in their environment that can cause a skin tear. The prevalence of skin tears, when I looked these up, it was interesting because acute care, we see around 12% of patients will actually get a skin tear. Community around 20%. Aged care has the highest, and you have to think about, you know, if they're entering aged care, they could be starting to lose their mobility and their gait function. So it's at up to 92%. But what I found most interesting in the studies I read is that nearly 15% of patients who are palliative will actually sustain a skin tear. I looked at the paper in depth because I was hoping to understand a bit more, but it didn't give me the information. Interesting. Now, how do we actually manage these skin tears? Well, first and foremost, we do need to determine the etiology. Generally, of course, it's obvious. It can be degenerative skin changes. It could be age, so younger or older. We do need to then use a classification system to actually rate the skin tear. And currently, the main ones used in the Australian context are 2 types, the STAR classification scale or the ISTAP skin tear classification. And I'll come back to that a bit more in a moment. We want to set the management aim. So, of course, we're going to stop the bleeding, approximate the edges, and then treat the wound according to the category. We want to establish good parameters. What can we do to prevent it happening in the future? Do we need to put limb protectors on the patient if they agree to that? Do we need to look at their environment to make sure that there is nothing there that they can bump into? Do we need to look at medications? Is there something causing them to actually become unbalanced or fall? So I want to just touch on the 2 types of classification systems that we use most frequently in Australia. And the first one is ISTAP, and we see this one mainly in a hospital setting. It has 3 categories. Type 1, there is no skin loss. Type 2, there is a partial flap loss. And type 3, where there's a total flap loss. The other classification system that we see mainly in everything outside of a hospital setting is the STAR classification scale, where we have category 1A, where the skin tear edges can be realigned and the actual flap has no discoloration. Or a category 1B, where the flap can be realigned, but the actual flap is quite discolored and darkened. Or a category 2A, where the skin tear cannot be realigned, but the flap is normal in color. Or a category 2B, where the skin tear cannot be realigned, but the flap is discolored and darkened. Or a category 3, where there's no flap at all. So when it comes to the STAR classification, it's really similar to ISTAT, except it breaks it down a bit further dependent on, is there discoloration in the skin flap? In other words, if I have no discoloration, I have good blood supply to that flap, it is viable, it's likely to heal in an ordinary fashion, which is around 2 to 3 weeks. If it's darkened, I have to really keep an eye on that flap because it could die and it may not reattach. Now, when it comes to the research, which one should we actually be using? Should it be the STAR or ISTAT? Well, in fact, there was a study done to test the validity and the reliability of the ISTAT classification system. And what was very clear is that it supported the evidence for validity and reliability, and it should be used for systematic assessment and reporting of skin tears. So in fact, the study that was done, a large study across 44 countries, proved that the ISTAT is the preferred method based on reliability and validity. However, having said all that, I understand completely that it's not that easy to change your systems, whether you're using iCare or eCase or, you know, a number of other systems. It's costly to actually do the updates. So I'm just giving you some of the facts and what the research tells us. Now, what we do know is that the majority of Australians, healthcare clinicians, are in fact using the STAR classification scale. So I'm hoping that those online, the close to 200 people online, are actually using the STAR classification, because I'd like you to have a go right now and looking at this wound on the screen, can you tell me what is the classification of this skin tear using the STAR classification system? Have a go and drop it in the chat. Let's see how we go. Good one. Cat 3, a 3, a 2B, no flap, category 3, lots of category 3s. Well done to all those. Yep, you're spot on. There is no flap. It straight away puts it into a category 3 skin tear. Well done, team. We're certainly not going to take the bit of flap that's sitting on the bed still and reattach it on the person. Absolutely not. Okay, let's have a go at this one. What do we think this classification is? To be, to be, to be or not to be? Lots of 2Bs. Looks like it's coming second nature to a lot of you. It's definitely a 2B. You can see part of the flap here, but you certainly can't realign it over the entire wound. And therefore it would be a category 2B because the actual flap that is left is quite discolored. Now, the reason I show this photo, and anyone who's come to my talks before, I always show this photo, is because quite often people will say, oh, I think it's a category 3 and a category 2B. And what I always say is you can't have two. It's one wound, so treat it as one wound. And in this case, it's a 2B, but everyone got it right. So well done. Okay, last one. What do we think about this one? What category is this? Oh, we've gone a bit quiet. What do we think this category is? Write in your response. Got a 3. Same pic, definitely not the same pic. New photo, yes. It hasn't changed. This is a pressure ulcer, okay. I would say 3, Slide did not change. Okay, sorry about that. Not a skin tear. Okay, here we go. It's not a skin tear. It's not a skin tear. Well done to those saying it's not a skin tear. You're spot on. It's actually, what do we think it is, guys? Anyone want to take a guess? Pressure injury, what stage? Testing your knowledge now. Well done, guys. It's a stage 4 pressure injury. Well done, Lynn. You got in just as I said it. Well done. Stage 4 pressure injury. And I do that because sometimes we get into a bit of an automatic mode and we just suspect it could be a skin tear because that's what was handed over to me at handover. But in looking at it, it's definitely not. Now, this is an extreme. You certainly wouldn't classify this one as a skin tear. So in terms of dressings, what do we need to do? Of course, control the bleeding. You do have to cleanse the wound. And what we actually suggest is simple things like normal saline will give it a good job. You do want to remove any debris. So think about a patient who may have fallen over on the gravel outside. Give it a really good clean. The biggest tip for all skin tears is to realign that flap as best you can as soon as you can. The moment we leave it to dry, and I know sometimes it's out of your hands because that's how the patient presents to you, we know that it can become quite hard and we have no chance then. We will have non-viable skin flap and it will cause a lot more problems. I always give the tip to keep yourself some medical grade cotton tips in your first aid kit. I always suggest having a first aid kit set up for skin tears on your trolleys or in your wards or at your GP practice or in your car for community, wherever you will be. Think about having a skin tear kit set up ready to go. So when you need to, you can grab it quickly. Having the cotton tips in there, you want to moisten the ends. Make sure you do that because you want no filaments left in the wound. And you want to use them to help you realign and get all those creases out. I always say it's such a satisfying job, not that we want any patient to be injured, but it's just like making a bed. You want it to be smooth and connect to the edges. It's a beautiful process, but maybe that's just me. And then you select the dressing type that you are going to apply. Now, I will refer you to the iSTAP website because they have some really great resources. This is one of them. It's a great flow chart to determine what to do. In particular, think about their general health. Do they have cognitive issues? Do they have a polypharmacy, more than, it's actually 6 medications, but I know in aged care you often track more than 9, but the recommendation by geriatricians is over 6. What's their ambulation like? What's their skin like? And it's a good way to track and review the patient. Moisture balance is huge. In particular, are they drinking enough fluids? And if the wound is non-healing after 2 weeks, sometimes 3 weeks, think about your patient and reassessing them because at some point it may go from a simple skin tear as this patient had and it now presents as an ulcer because they've got underlying venous disease that can ulcerate very quickly. So we do need to monitor these skin tears quite closely. Now, what the guidelines do clearly show is that we shouldn't be using certain products on skin tears. The biggest one is iodine-based dressings. We shouldn't be using them on skin tears. We shouldn't be, of course, using hydrocolloids or films on skin tears. We've gone away from skin closure strips like steri strips. We're using more silicone-based, and we don't simply put gauze on these wounds anymore. So as I said, look, if you've got your cameras, you're welcome to take a photo of this screen. Here's some of the things that I recommend you have in a little kit set up, ready to go, should anybody injure themselves and get a skin tear. So my final tip for you all is don't give up on protecting the skin. Really focus on prevention. And there are plenty of things that we could be doing, such as risk assessments. We do want to make sure people are wearing sunscreen, even in winter, thinking about the soap-free alternatives that I've spoken about. Nutrition is key, nutrition and hydration. And when we talk about hydration, it is in the evidence. And I know that this paper was written in 2014, but it's so relevant. This was a large randomized control trial across multiple aged care homes. And all they did with as an intervention was to apply a moisturizing cream twice daily to the lower legs. And the science behind it and what it showed was that if you do that, you can reduce skin tears by up to 50%. That's huge. So if you're not using emollients, think about putting them on. The other thing to think about is if you've got patients who are frequent fallers, let's go away from thinking it's just because of their age. Let's start thinking about other factors such as, is it drug associated? And here's some key ones on the screen that can actually cause issues with mobility, particularly in the older person. And I guess what I would say is remember that dressings are 10% of wound care. Your assessment is very, very much just as important. Now, I popped a couple of frequently asked questions on the screen because I don't know if you're thinking about these now, and I'm almost done with my talk, but these are things that I get asked all the time. Is zinc appropriate for treating skin tears? Well, when we look at the actual evidence, there's nothing supporting that zinc should be used. And in fact, when I went to the ISTAT website, they were very clear that they do not recommend using this to treating skin tears. So keep your zinc oxide to babies with things like a diaper rash. What recommendations are there for wound cleansing tools? Well, there's lots on the market at the moment. So normal saline is pretty simple and should be considered for all skin tears. You might want to factor in, has the patient had a tetanus shot recently? So have a look at their history. And I've got a couple of other things on here too. One of the ones I'm sure you'll come up with at the end is, should we cut off the skin flap? What I will say to that is always aim to preserve the skin flap and maintain that surrounding tissue. You might need to debride it down the track, but we do want to prevent it from breaking down. So my take-home messages today is to always protect the skin in the first place, thinking about emollients twice a day, perform risk assessments, implement preventative strategies, use a classification system, and consider dressings that will be gentle on the skin, such as things like your silicone dressings, which most these days you can leave on for up to 14 days. So it's really worth putting on silicone dressings, particularly when most wounds take 14 days to heal. Now, if all else fails, I give you one final tip, and that is bubble wrap, because at this stage, if you've put everything in place, you've done the best you can. That is the only other recommendation I can give you. And with that, I thank you all for your time today. If you would like to stay in touch with our services, please take a review of the QR code on the screen now, and I will happily hand over to Angus, who is going to present to you next. Thank you.
Thank you very much, Hayley, and good afternoon or good morning, everybody. I'm going to put my thing into slideshow. Really appreciated that talk, Hayley. Very clear, very practical and informative. Thank you. I'm sure everyone enjoyed it as much as I did. So I'm the person who looks after the Allevyn brand in Australia and New Zealand. It's a pleasure to be here. And I will take you through maybe 5 or 6 minutes of an overview of ways in which you can treat skin tears with some foam dressings. But let's get the ball rolling with a video just to keep the energy going. And then after my talk, I will hand back to Hayley for some Q&A.
We know why you went into nursing. You want to provide outstanding care and attention, to make a difference. But we also know that these days it isn't that simple. There are more patients, smaller budgets, and fewer colleagues to pitch in. There are older patients with more complications, younger patients with higher expectations. And what's more, the cost of wound care has increased to $8.3 billion. The result? It feels like everything is stacked against you. What you need is simplicity and performance from the foam dressings you use, and from the company that provides them. At Smith & Nephew, we're shaping what's possible in wound care. With our Allevyn dressings, you get all the essentials you expect from a foam dressing, and more. Now it's possible to release time, waste less, and improve lives, including yours. With their extended wear time, along with their ease of application and removal, Allevyn wound dressings work hard to give you back valuable time. You'll have more time to plan, time to talk, and time to care. With reduced dressing failures and 20% less packaging, Allevyn foam dressings are also helping reduce the burden of waste and positively impacting the associated costs. Additional features include high conformability and comfort, as well as advanced lock-in and absorption technologies. And we know that what you really care about goes beyond the products. That's why we're offering you services and solutions that illuminate, aid, and support across the treatment journey. At the end of the day, it takes a great deal of innovation to be this simple. Basically, Allevyn Life foam dressings ease the worry for leakage. Essentially, Allevyn gentle border foam dressings stay in place. And now, you can provide the care and attention your patients deserve. The care you wanted to provide from the very beginning. Allevyn wound dressings. For what you really care about.
Okay, so we talked broadly then, or rather you saw broadly then, about our Allevyn brand, which we're very proud of and has been around for a long time, and I'm sure most of you are very familiar with it. What we'd like to talk about specifically, of course, further to Hayley's talk, is Allevyn for skin tears. So Allevyn Gentle Border Light is our most recommended dressing for treating skin tears. Most of you know that will come in 3 different shapes: the Allevyn Gentle Border Light Square, rectangle, and oval. And in fact, the oval has probably been the most widely used. So moving into some of the details, as you can see here, Allevyn Border Gentle and Allevyn Border Gentle Light, Gentle Border rather, is part of a broader range of our Allevyn product range. So Allevyn Life, you can see at the top there, that's really for our highest exudate level, for our moderate to high exudate, and is for a whole range of things, including pressure injury prevention, ulcers, and diabetic foot ulcers. However, the Allevyn Gentle Border dressings are the 2 that are specifically indicated for skin tears. Now, traditionally they're for more low to moderate exudate, but what makes them very different is the gentle nature of the silicone adhesive layer, which I'll get into shortly. So they're indicated for all of those other things as well, but they're also indicated for skin tears. So moving forward, this is the range, if you like, and you can see how they can fit onto a range of different parts of the body. They're highly conformable and comfortable, and as I said earlier, they do use a gentle silicone adhesive. So more specifically, it is a very soft silicone thin absorbent foam dressing. So the features of this particular dressing are gentle silicone adhesive, which is much more suitable for that fragile and sensitive skin that you get with the elderly and people who can get skin tears. As Hayley mentioned, these silicone foams can stay on for a lot longer than other dressings. So in the case of Allevyn Gentle Border Light, we recommend for up to 7 days, and we do know that people do use them for longer. Our recommendation is for up to 7 days. Very conformable as well as comfortable. So they do conform with the different curves and structures of our body, and very flexible too, which is a little bit different to Allevyn Life, which is a bit more fixed because it's much thicker with its 5 layers. Allevyn Gentle Border is a 3-layer dressing and is able to stretch around joints and areas. Of importance too is that top film is permeable to fluids being able to move out of the wound where necessary to maintain a good fluid balance, but it's also waterproof and will provide a bacteria barrier from contamination. But the real, I guess, champion of the exudate management is the foam layer, which in this case of Allevyn Gentle Border Light, it is half the thickness again of Allevyn Gentle Border and is still going to be able to absorb lowish to moderate levels of exudate. And finally, I guess the thing that really makes this perfect for skin tears, as I said, is the soft silicone adhesive wound contact layer. It won't adhere to the moist wound bed and is very gentle to dry tissue. It will minimize the stripping of skin and can be lifted up and repositioned. So I guess in summary, Allevyn foam dressings are absorbent, they're protective, and they're gentle. Their hydrocellular foam is expertly able to balance absorption and retention for the right moist wound healing environment. They're protectable, as I said, with a bacterial barrier and waterproof, and they're very gentle. The contact adhesives are easy to apply and remove, and in fact can be lifted if you do need to check the status of the skin tear as well. And as Hayley said, we do recommend that you draw an arrow on the top in the direction of the flap. So in summary, guys, if you wanted to know a little bit more about Allevyn, please feel free to use this QR code that you can see on the screen. This will direct you to a website with additional information and also an opportunity for you to request a sample. Please make sure to mention where you can that you're interested in Allevyn Gentle Border, but we can reach out and talk to you about that once you've left your information. I don't have anything more to present. I'm now going to hand back over to you, Hayley.
Okay, thank you. I think we're handing back to Angus. So, Tom, over to you.
Yeah, no, thanks, Hayley. Thanks, Angus. Again, fantastic presentations. So we've just got a few minutes for Q&A, and these are some questions that came through the chat as we went through the presentation. So Hayley, I'd say this one is for you. Can we use the wound irrigation solution Octenolin on skin tears?
Yeah, absolutely you can, whether it's the Octenolin, the microdacin, the granudacin, or as I said, simply normal saline. You can use those products. There's no issues with that. At the end of the day, the key focus is to strip any debris under that skin tear. So think about what you're washing out. That's not a problem.
Thank you. Another one here is, in a clinic where we are not able to afford expensive dressings, would it be appropriate to use products like Bactigras or Gelinet?
Okay, so good question. Both of those products are paraffin-based products. The problem with paraffin-based products is that they can actually cause the wound to become macerated. They are too wet, they are too moist, and you've got a flap that needs to really sit still and not be pushed around underneath the dressing. So I would consider not doing that. What I would actually also suggest, and I work with a lot of GP practices, I'm not sure if that's your area as well, but the expensive products can be very problematic for GP practices in particular. And so what I did with 3 GP surgeries is we actually looked at the cost of a silicone dressing, higher in price, absolutely, but being able to leave it on for a lot longer, as opposed to something like your paraffin dressing that would need to be changed every 2 days. And interestingly, you were far better off paying the extra dollars for the dressing that could stay on for 7 to 14 days than you were the cheaper dressing that required every 2 days. So I would suggest have a look at the products, do a bit of a cost analysis and rethink what you're using.
Couldn't agree more. Thanks, Hayley. We had a question just come up in the chat then, and I'm not sure, Hayley or Angus, on this one, or maybe this is even for Team Medical. Why are steri strips being phased out? Are they being phased out?
Yeah, I'm happy to take this one as well. Look, we phased them out probably over 10 years ago now, dependent on the patient's skin type. So if you think about it, if you go into surgery today and let's say you have a Caesar, the first thing the GP is going to do after the doctor's going to do after he closes you up, he's probably going to put some steri strips over the top. That's a surgical intervention, makes sense, no problems, the risk is low. But if I was to put a strong adhesive like a skin on a skin tear for someone say over the age of 70, where it can actually tear their skin when it comes off, that's problematic. There are other problems with how we actually used to apply them. We used to see skin tears over the top of each other. Okay, and then we also seen that clinicians would come along a week later and try to pull them off one by one. And Steri-strips were designed to stay in place until they came off on their own. So it's all about the skin type. It's not that we shouldn't use them. We just shouldn't really use them on fragile skin such as the elderly.
Thanks, Hayley. I've got 3 more questions here, and apologies if this doubles down on some of the presentation. I guess, what is the number one reason people get skin tears?
Yeah, look, the number one reason, and I'm going to talk from a clinical experience point of view, it's often, yes, the elderly. We've seen the stats, particularly in aged care homes, up to 92%. But the reason is we need to start looking at their footwear. And it's Christmas coming up, so start doing some promotional webinars for family members who are going to purchase shoes, because I often see in an aged care environment ill-fitting shoes, in a home and care environment as well, ill-fitting shoes, which causes the patient to do a bit of a shuffle or not be able to lift up their feet well. They're looking more at comfort as opposed to what's good to stop them falling. So my number one tip, consider the shoes.
Thank you. That probably answers the next question, which was the number one thing you can do to prevent skin tears. Get the right shoe. Is that fair?
Get the right shoe, and I'd probably say don't forget about the importance of emollients twice a day. So have a look at what emollients you're using. I don't like to say brands, but we do know that Sorbolene just doesn't cut it anymore. We know that it can actually lead to drying of the skin. So think about a pH neutral emollient. I mean, some of your higher level ones such as your QV products are amazing, but always talk to your pharmacist who can advise as well.
Thanks, Hayley. And last one, what role does technology, such as, say, AI, have in a place in skin tears? Does it have a place?
Yeah, look, absolutely. This is the world we're living in. You know, COVID certainly shifted the way we think. We've propelled into the world of telehealth. One of the things that I'm passionate at with Wound Rescue is that our AI and AR technology, we actually use goggles to do our treatments with a command center. And where we're at is devices and apps that can now look at wounds, and the AI technology can determine how big is it, what's the size of the wound, what are the colors we're seeing. The technology I'm using can do all of that and one step further. After our consultation is finished, it actually goes ahead and writes the notes for us as well. So we've got the treatment plan from our discussion. So watch this space and keep an eye out for the digital world, because it's certainly shifting things.
That's quite amazing. Thanks, Hayley. Well, guys, that brings us to the end of the webinar. In the chat, you'll see a link to a survey. Please, if you have a minute, it's quite quick. Any feedback is appreciated, again, so we can continue to improve on these fantastic seminars. Hayley, thank you again for an amazing presentation. We really hope this webinar has been of great value to all participants, and for those that will watch on demand. You will receive an email from Team Medical tomorrow with a PDF certificate and a link to the recording. Again, thank you. This will wrap it up. Please feel free to fill out that survey with any feedback you have. But thank you.
Thanks, everyone.